I'm familiar with this technology, so I can direct questions back to Dr. Citron if you have questions.
Okay. So this is Julie. Julie came to us complaining of these spots on her face, brown spots and red spots. So we're going to just show you how you can treat these with the BBL device. So I'll need the small reducer, please. Okay. Can you just put the camera on the screen for 1 second? Okay. So I'm just showing you how we set the screen here. Okay. So we're using a 515 nanometer filter. This is a high-pass filter, so what happens is any wavelengths below 515 are filtered out. Only wavelengths above 515 nanometers pass through that. All the melanin absorption is above 515 nanometers. So the pulse width is the number of milliseconds that this stays on for. So I'm going to reduce this to the minimum pulse width I can get, which is 10 milliseconds, which delivers the energy very rapidly. That minimizes absorption by surrounding tissues. And I'm going to set the temperature as low as I can get it to protect the tissues. Okay. So I'm setting this at 10 degrees, and you can see you can alter the set point of the temperature by touching the proper spot on the screen. This is a handpiece. This part is cooled. It's a computer-controlled solid-state cooling device, and we can fit these reducers on here which decrease the spot size. I'm going to use a very small reducer on it. And here, open that. And we'll use a reducer. We have to load it with gel. Yeah, yeah. And that just couples it nicely thermally. And then we have to give a few seconds for that reducer to cool off. So now the spot size is reduced to a little circle. We also have a larger circle for larger lesions. Here's the filter. Filter drops in. It's in the handpiece. Here's another reducer for square areas. So when we use a reducer, we have to turn the energy up a little bit on the machine because the output's reduced. So now if we could just go to this lesion over here. My glasses from the sport coat. Hang on. Just 1 second. So So you notice the patient has eye protection, nice eye shields. You want to have everyone in the room wearing eye shields. When I do this, I don't wear eye shields. I close my eyes before firing it because I need to be able to see what I'm doing. So we put a little gel on the contact point and direct it right over the lesion. And put on ready, please. And the device will fire. Here we go. Now, can we get a close-up here? So what you'll see over the next few seconds, you'll see a little bit of darkening of the pigment in that, which denotes denaturation of the melanin. You may see a little bit of redness around there from inflammation. You see it's turning, I don't know if you can see that out there, but it's turning pink right now.
Yeah, it's projecting very well.
You can see it?
Mm-hmm.
So that shows a good treatment. If we didn't have that type of response, we might turn up the energy a little bit. Again, look at this lesion, the little brown spot.
And let's talk for just 1 second about the important things that you should look for when you're choosing an IPL device or a BBL device, because you need one for your practices,
Okay.
because you really do. And I think
Anything else
that
we can treat here?
having a sapphire crystal is important for conducting heat away from the treatment area. I think being able to adjust the temperature of the cooling plate is critically important because everybody will need a different amount of cooling. We've been talking about different skin types, and your darker skin types absolutely require more epidermal protection. And so being able to adjust the cooling by degree is a very, very important feature on an IPL device. And then thirdly is what are the consumables or the life of your flash lamp, because some of the less expensive devices actually have very, very short lifespans for their flash lamps, and so you get these surprise bills for $12,000